So done with the first afternoon clinic of the day. Saturdays usually a jam-packed day. No, so full schedule the whole day. Ever since COVID, most of my schedules have been shifted to morning, and then just one clinic in the afternoon. Anyways, for this clinic, there's still a lot of upper respiratory tract infections, and good thing is that most patients responds to the usual upper respiratory tract treatment, and most of them does not progress to pneumonia or a lower respiratory tract infection. So good job, and hopefully we maintain it this way.